This clip is sponsored by American Mobile. If you're a nurse interested in traveling, visit americanmobile.com to get started. I want to talk a little bit more about some of the complex patients you were talking about, like, what does a really busy patient look like some of the drips that you have, or, like what makes them complex?
So I think it just, of course, depends on the patient diagnosis, but we have some babies, the preemie patients especially, that have a whole bunch of lines. So typically they may be intubated, and that is where we give our oxygen support to the patient. And so some types of machines we may use is the typical mechanical ventilator, or we use an oscillator. It's a little bit bigger, it's very loud. I think even adult world, you guys use that as well. And so that helps with oxygenation and things like that. Other things too is just tubes everywhere. So they usually will have an umbilical line. That's usually the first thing we'll place for these patients. And so that's where we give them their IV nutrition, medications, and sometimes if necessary, we may give blood through it as well.
So it goes in the umbilical.
It does.
Wow.
Yep.
Okay.
So there's a very short time window for you to insert that. So we try to do it immediately after they're born,
Okay.
Just to prevent any other invasive procedures on them, like IV sticks and stuff like that. So
Yeah.
it's nice because then we can use that as an access to give them nutrition, medications, fluids, and we do monitor their blood pressure continuously with that too, with the umbilical art line. And so, they have that. They also have an OG maybe to help vent them, because there is a lot of air being pushed in, and sometimes that can expand their bellies and can be difficult for them to breathe. So they may have an OG for them to vent. If they're not peeing, we have Foley in them, and they just have all their extra lines, like their EKGs and pulse ox and things like that. And we do monitor some patients too. Another patient that we get often as well are just difficult deliveries, or something happened to mom where the baby comes out, needs a lot of attention. So we may do cooling on some of these patients. And what cooling is really is, it helps to stop that temperature. It keeps basically the patient from possibly getting a high infection due to fever and things like that. And so the cooling helps to drop their body temperature. And we monitor them very closely for that. We may do an EEG on them, where we'll put like stickers, leads on their head, and helps to monitor for any seizure activity during that time period, because cooling is a very invasive procedure. Of course, imagine your temperature being cooled down to an extremely low temperature. So we have to monitor and be very careful of any possible seizure activity. But a lot of times patients that are very sick that we are looking out for is just patients that just are very unstable with their fluid management, blood pressure, medications to help with their blood pressure, keeping them stable. And that's why we put the umbilical art lines, so that we can continuously monitor and address any situation. If they are dropping, we can increase their blood pressure medication, so they can have drips for that. Just constant medication and fluids to help with, like, if they are losing fluid or if they need to retain any, we can help with that as well. So that's usually some complex patients that we get, just a lot of fluid management, having to adjust and accommodate for any sort of blood pressure instability, sugar levels instability.